Well, thank you very much, and good morning, everybody. I'm sort of delighted to be here. We got some news on another issue, which we'll talk about later, that isn't such good news. But I am delighted that we're releasing today the state of HIV, hepatitis, STDs, and tuberculosis, the status of things here in the District of Columbia. I want to recognize our Director of the Department of Health, who we are really fortunate to be able to have him in our leadership capacity there. Dr. Joxel Garcia, as you all know, at one time was the top health official in the United States, and of course for 4 years was the Distinguished Director of Health for the entire state of Connecticut. So, Dr. Garcia, we're always delighted to have you. We also have our Senior Director for the Department of Deputy Director, who heads HOSTA, and that is Michael Carfin, who is with us also. Michael. And we have our Deputy Mayor for Health and Human Services. I feel like I've been with you every hour for the Yeah, absolutely. And she's done a fabulous job for 3.5 years as our Deputy Mayor for Health and Human Services. And of course, is Deputy Mayor Bibi Otero. Bibi, we're glad to have you. We're also glad to be here at Bread for the City with George Jones, who is someone who I've worked with for a very long time. George, I want to thank, where's George? There he is, over here. I want to thank George for his leadership across the city and for opening the door for so many people. I've been here any number of times, and it always is a receptive place. And I know that in a substantial part is because of the receptivity and that environment that you've created here in the District of Columbia and certainly in this area of the city. George, thank you very much for what you do. Bread for the City, for those who don't know, and I suspect most of you do know, provides primary medical care to a number of vulnerable residents and has been a strong partner with the District of Columbia, has worked side by side with us in our efforts to reduce the number of new cases, being able to control the number of cases emanating from injection drug use, and has helped us greatly with our needle exchange services here in the District of Columbia. I well remember the days when, what a battle that was. Anybody remember the days when the Congress wouldn't let us spend our own money on needle exchange programs? And we had an organization, Prevention Works, that established itself and did an outstanding job until we finally surmounted that hurdle. And of course, that is yet another example of the continuum of colonialism that we experience in the District of Columbia. But we surmounted that one, and I think has been a major contributor to us being able to make the progress that we have made. Bread for the City also is contributing to our fighting of hepatitis C and has been an on-site testing venue as well. For being able to continue to expand screening, especially among the baby boomers and persons with a history of infection drug use. The annual report, which provides the latest snapshot of the HIV/AIDS epidemic through the end of 2011, shows, and this is the good news, that the District of Columbia continues to make progress in collaboration with many partners across the community. The number of new diagnoses from needle transmission decreased by 81% from 109 cases in 2008 to 21 cases in 2012. That is an enormous drop, ladies and gentlemen. And organizations and lots of people, many of whom are in this room, Walter, can take great credit for helping us be able to come together as a community to be able to fight the scourge of HIV and the transmission of the virus here in the District of Columbia. I don't think it'll be long before 21 will be zero, ladies and gentlemen, and what a day of celebration that will be. Though last Friday, June 27th, was officially National HIV Testing Day here in the District of Columbia and lots of other places. I think we all know that every day should be considered a day of testing. And we emphasize that everyone, people from ages 13 up through age 84, should get tested at least once a year. Testing is the first step of knowing your HIV status, and if you're positive, getting into care and treatment. Today, there is no question. I think everyone knows now that if you get into treatment and maintain your regimen, your regimen of treatment, that you will live a life that is as normal and as long as anybody else. And that is incredible progress that we've made. Obviously, we hope that no one contracts, contracts the virus, contracts AIDS, and develops AIDS. But if you do, it's no longer a death sentence. That used to be the phrase that a lot of people use, that AIDS was a death sentence. It is not a death sentence, ladies and gentlemen. You just have to make sure you get tested, and if you happen to be positive, you get treated, and then you stay on your treatment regimen for the duration. And by the way, I'm going to be taking my annual HIV test today. And those who haven't had a test recently, I invite you to join me in taking a test also. We know that learning about your HIV status reduces the chances of transmission of the virus from one person to another. Not to be glib, but treatment is prevention, and prevention is treatment, ladies and gentlemen. We have seen treatment reduce the presence of the virus in people's bloodstream, for want of a better way, to an almost undetectable point. And we need to continue to do that because as it goes down, obviously you are less likely to transmit it and less likely to have the effects of being HIV positive and developing AIDS. I'm pleased to report that the District of Columbia's effort to reduce new cases of HIV continues to be incredibly successful. We were one of the first cities to embrace the national HIV strategy that was developed under the President, and we've maintained our commitment to that over the last couple of years, 3 years, 4 years, whatever the case may be. We are making progress in this difficult battle to partly to using innovative weapons in the fight to save lives. For example, the Department of Health, through Dr. Garcia's leadership, has a partnership with the Department of Motor Vehicles. In fact, the DMV location at Penn Branch, just off of Pennsylvania Avenue, does testing. And in the last year alone, at that one DMV site, they conducted 7,000 tests that were done there, and that was something we want to expand. I want to thank our director of the Department of Motor Vehicles in the District of Columbia, Lucinda Babers, for being a great partner. It's yet another example where collaboration in ways that wouldn't typically be obvious can produce results well beyond what we might think is possible. Who would have thought that DMV and DOH coming together on HIV would produce positive results, ladies and gentlemen? And in this instance, I'm using positive in a very different sense than HIV positive. It is HIV positive in preventing new cases of transmission of the virus in the District of Columbia, and that is a good thing. In addition to the DMV director, I want to thank Dr. Betty Hamilton. I don't guess she's here today, is she? She is the Director of Family Medical Counseling Services and is a longtime fighter in the battle here in the District of Columbia. The DMV testing initiative is just one example to show what we've been able to do, and the statistics, I think, are a prima facie case of the progress that we are making. For example, I see Don Blanchard back there. I want to thank Whitman Walker over the years, too, for what you have done, Don. You've done a great job of continuing the great progress and work of Whitman Walker in providing a lot of care, but also in continuing this battle. And I know you're just as proud of where we are today as we are. So how about a big hand for Don Blanchard for the work that he's done at Whitman Walker. And by the way, the number of new cases reported in the District of Columbia has been reduced by 42% between 2008 and 2012. We've gone from then 1,180 new cases to today down to 680 in June of 2012. You know, and our data always follow, you know, behind, probably with more time in between than we would like to have. That's now a couple of years, but that's the way with data analysis, right, Dr. Garcia? If we get it wrong, people will say, you hurry up. They'll just say you should get it right. That's what we work to do to get it right. But I suspect that we're probably less than 680 new cases for 2013, but we will know in the foreseeable future. We saw a 35% decline in the number of newly diagnosed AIDS cases and a 36% drop in the number of deaths among persons with HIV in the District of Columbia. We also made some progress in terms of tuberculosis. We're not going to talk a lot about that today, but you know, we started to see a flare-up, a reemergence of that in the last couple of years, and we're working hard to make sure we keep that under control as well. Let me just add a few more facts to this. We had a new record for administering 177,000 publicly supported HIV tests in 2013. That is the largest number that we have ever administered in 1 year in the District of Columbia. It was up from 138,000 in 2012, and is 4 times. Go back just to 2007. We had only 43,000 tests that were administered in 2007. So since 2007, we've come from 43,000 to 177,000. And what that bespeaks also, ladies and gentlemen, is the fact that we have increasing awareness across this community, and people are taking testing very seriously. We also distributed more than 6.9 million condoms in 2013, which is a 14-fold increase from 2007. And those of you who pass math, you can do the math and divide 14 into 6.9 million and see what you get. But that would not even be close to a million, would it, Walter? It probably. Well, let me see. That would probably be somewhere in the neighborhood of 350, 400,000, which sounds about right to me. You know, if it's not right, sorry. And you know what? Actually, it is in 2012, we had about, I'm not sure. I'm going to leave that alone. We also removed 647,000 needles from the street in 2013, and that is a huge increase because just in 2012, we removed 550,000. Think of that, from 550,000 to 647,000. That is about a 18% increase in removing needles. And some of you will recall that we established 3 goals when we established our most recent AIDS Commission. One of them, of course, was ending the epidemic, and we continue to be committed to that. And yet another was treatment on demand. We have served 8,400 persons in 2013 with universal access to HIV medical care, and we no longer have any waiting lists for treatment and medication in the District of Columbia, and that is a huge, huge step forward, ladies and gentlemen. I think the point is a dual point, and that is we have a lot of work yet to do, because we cannot rest until we get to the stage when we say we have no more new cases and we are on our way to a cure. And I don't even think we're that far away from that, to be honest with you, because some of what we're seeing around the world, especially in some of our European nations, send a lot of hope that we may be nearing a cure. And we need to continue to work hard with our prevention efforts here in this city. So I'm going to ask now Dr. Garcia if he would come up and talk a little bit about some of the details of this year's report, which I hope you all got a copy of it. How many of you have a copy of it? How many of you don't have a copy of it? How many of you couldn't care less whether you have a copy of it? No, I'm sure that everybody in here cares deeply about this, otherwise you wouldn't be here today, and lots of people outside of here care deeply about it. But it really is an outstanding product that sends a lot of hope to people in the District of Columbia. So we're going to have Dr. Garcia come up, and then we're going to have Michael Carfin come up to talk even in more detail, our director of HOSTA. And then we're going to have George Jones to follow him. So, Dr. Garcia, you're on, sir.
Thank you, Mayor.
Absolutely.
Well, good morning, everybody. Good morning. And I want to thank Bedford City for hosting us here. It's a very beautiful place and great partnership that we have with you. I also want to acknowledge all the work that the Mayor has done because, like the Mayor mentioned before, I have worked with public health in many different places before. And this is the only city, the only state in the nation that has seen this improvement in terms of the battle against HIV. And I have to say, it's the leadership from the leadership from the top what makes the difference. So I really want another round of applause for the Mayor because this has been, it's actually his vision. So to add to what the Mayor has shared with you, I'm just going to go through some of the data. For the first time in the district, we are going to be reporting also incidents of new cases, and that's to essentially match what the CDC, the Centers for Disease Controls, they do. And related to the data, we take 2 years to publish our data officially because we work with the feds and ourselves internally to validate our data. But within the next 6 months, we are going to have a dashboard, web-based dashboard, where anyone here in the room can actually log into our website and look at the preliminary data that we have. So, and I just want to mention that because it was asked before in terms of if we didn't know about the data for 2012 to 2013, we had that preliminary data, and we react to that data if something is happening. So if we see a cluster, we will go and attack that cluster in that specific part of the district. So do not get confused in terms, we are not presenting 2013 or 2014 data. That data preliminarily we have, and we work with that data internally and with our partners. The other thing that I wanted to announce, there's no exciting news related to hepatitis C. Hepatitis C is a disease that nationwide, we had 3 cases of hepatitis C per each case of HIV. And it's the #1 cause of liver cancer and liver transplant in the nation. So we start collecting the data, and here in the district, the sad news is right now we have the same level of hepatitis C that we have of HIV. We have over 15,000 cases, 15,915 cases of hepatitis C versus 16,072 cases of HIV. But 75% of the people that have hepatitis C, they don't know that they have hepatitis C. Therefore, we have more cases, and we essentially have not been able to confirm them. So now we have a cure for hepatitis C. There's 2 new medications in the market. There's 2 more coming. We are working, Michael Carfin and his team are working with different partners in the community, with the hospital groups, and also with the clinics and the community partners and leaders. So we would be one of the first states working with the CDC to implement a program here for hepatitis C, against the battle of hepatitis C. And we think we will be able to eradicate hepatitis C as well. The other thing I want to talk is about the care, the continuum of care that we have here in the district, like the Mayor mentioned, is one of the big arms that we have here to tackle the battle against HIV. Actually, if we had had that, we probably would have had a better outcome of yesterday's game, which is a heartbreaker. But that's why I don't want to think about that and think only of good news. I Actually, I just found out Don Blanchon used to play soccer, so that shows. Maybe we needed him there. But one of the things that I want to mention about that is we have the program, which is the red carpet entry protocol, which is a national model. And right now, I can tell you that we have increased from 57% to 82% the early entry into HIV treatment. And that's unheard of. And that has to do with the work that not only the department does, but essentially our community partners and our healthcare providers. And I think now with Affordable Care Act, there's no excuse for primary care providers not testing their patients neither. So if we combine Affordable Care Act and essentially the red carpet protocol, I think we will be able to test everybody here in the district yearly and essentially be able to eradicate and prevent the disease. Another important data is the viral load suppression. The average for the CD4 counts, and for the people that do not know CD4, they are the T helper cells, the white blood cells. They attack bacteria and viruses. So you have to have 500 to 1,500. Those are the normal numbers. So when people are diagnosed, if they are lower than 500, they are at a higher risk to get complications related to HIV early, including if they are lower than 350. The average right now in the district, I tend to bet that we're the highest in the nation, is right now 435. And that's an increase from 330 in 2008. So that's huge, because that means that we are getting the diagnosis early and we are able to tackle the disease earlier. And like the mayor said, HIV now should be considered a chronic disease if the person is diagnosed early and continues with the treatment. So again, I just want to thank all the community leaders and all the people involved here, and Michael's leadership and the Department of Health for all the great work that they have done, and all the community partners. Really, I don't want to go by my names because there's so many of you here. But again, this will have not happened if the mayor has not come to bat. And I think, honestly, sir, you were like Howard yesterday. You stopped every bad things that were happening here with HIV, and you're moving forward. So thank you very much, sir. And now with you, Michael.
Well, good morning. The mayor and Dr. Garcia basically gave the details that I had hoped that they would be giving this morning, so there's not much more to me to fill in. I do want to also thank very much the mayor's leadership for the years that he's done in multiple years, going back 20 years, in working on the first HIV commission here in the district, and the first efforts around the response to the epidemic to where we are today, which is a complete sea change from where we were 20 years ago. And thank Dr. Garcia's leadership, both his global and his national leadership that he's brought to the Department of Health and to the response to the epidemic. And I just want to acknowledge also some of the partners that made this report possible, particularly the team at HOSTA. I see many of my colleagues here, Adam Alston, Brittany Sefir, Jenna Puku. Those were the staff that really put together today's report. And then also, really, this was made possible through our partnership with the George Washington University Millikan Institute School of Public Health, represented here today by Amanda Castell. So those really were the people behind getting this report done. And as Dr. Garcia mentioned, our aim really is to be able to get this data to our community so they can put it into action, because really the value of what we report today is how it drives our programs and our policies and among our community partners. And I see many of them here, and I see the chair of our Ryan White Planning Council, Steve Bayless, here as well, Michael Kelly from Department of Housing and Community Development, because housing is one of those important areas in terms of people's being able to live healthy is to have a healthy housing setting. So I just want to add to say to this is that there's what these numbers really represent and how they motivate us towards in our partnership with our community is that these are really achievable for us to get to zero. Is to get to zero new cases and to create what I hope to see is an HIV-free generation in the District of Columbia. And that's really possible because of the collaboration from the people in this room. Thanks to George Jones and Bread for the City for hosting us, and some of our other community partners. I see La Clinica de Pueblo here and others. So with that, I will complete those talks and then back to the mayor. Oh, I'm sorry.
Good morning, everybody. I won't say much. I think all the important messages have been sent. I do want to welcome everybody here to Bread for the City. Vince, you and I have been friends and partners in this work for a long time, almost 20 years. And so thank you for your leadership as the mayor, but thank you for everything you've done even prior to your stint as leader of this city. Dr. Garcia, thank you for your work. Thanks for coming and sharing the message. Mr. Carfin, thanks for all the great work your office is doing. And I want to thank our patients who are in this room somewhere trying to get their visits. Thank you for allowing us. This is an important event. It's important to get this word out about testing and the work that the district's done, but it's also important for our clients. We promise everybody who comes here that they'll get service with dignity and respect, and we hope that we've still been able to maintain that as we've had this event play itself out today. Bread for the City is a community agency that's been around 40 years. We actually consider our system a holistic service center. We provide medical care. This is a 5,000-plus square foot facility. We see about 3,000 patients each year. Each of them routinely are tested for HIV, hepatitis, and TB, and all the other STDs. And so we really believe in making sure that people who come to us get access to testing, but they also get access to our food pantry, to our social services and counseling services. They get access to our legal services around issues concerning access to housing, health benefits, all benefits, not just health, but disability benefits. They get access to support around family issues. And so we provide a holistic net of service, because the truth of the matter is things like testing and health care are important to health care outcomes, but really it takes a kind of holistic response. You know, what many people have come to talk about are social determinants of health. That's what Bread for the City is all about, is trying to impact all of those issues that will help people stay healthy, including, pursuing prevention like testing for HIV, but also eating healthy and seeing your doctor annually and all the other things that go with, the traditional healthcare strategies. We think that these other net of services we offer are just as critical, maybe sometimes even more important, to helping people stay healthy. So it's our pleasure to have you here. Thank you so much for the work that you're doing here at the district government. And I guess if there are any questions, I'll step away and let you ask them.
All right, thank you, George. All right, thank you very much, George. We're going to take some questions, then I'm going to do my test. Mr. Sherwood?
Mr. Mayor, I'm looking at the report. It's July 2014. Why is the report for 2012, a year and a half ago? What takes it so long to get this?
I was addressing that when you went downstairs, but I'll do it again for you.
Do it again, briefly.
It's the nature of epidemiology and data analysis, and that is the data gathering and the data analysis process takes a long time, and I'll ask Dr. Garcia and Michael Carfin to join me, but to be able to feel like you've got reliable, valid analyses of data, it oftentimes takes a long time. You see it with infant mortality also. Sometimes our infant mortality rate that we're using may be, this is 2014, we're probably still using the 2012 rate or 2011. So it's just the nature of science, it's the nature of the deliberative process, and there probably will come a time, Tom, when our technology allows us to speed that up. But I think those who are scientists feel like to have the most reliable data, you've got to make sure you take the time after the period is ended to ensure you have all the data, and then the analyses themselves take an awful long time. So that's why I
understand that. Thank you. The other question is, why is it compared to 2008? I know that 2008 is the baseline year of when this was started, but can I look at this report and see how well the city has done compared to last year, or do I have to compare it to 2008?
Mike, yeah, come on. I think you can, but let me ask Dr. Garcia and Michael to address that.
And also to add to the first question that you asked, we validate the data. So if you look at the data in Connecticut right now, they have some preliminary data right there, and then they have to correct that data retrospectively. And essentially that confuses a lot of people. The data here in the district is pure data, so that means that it already had been validated. What we're going to do within the next 6 months, we're going to have in our dashboard that is going to be web-based, you will be able to log in the month of June how many cases we have preliminary. We have that data internally, so we work on that data and we react to that data instantaneously. The second aspect, like the mayor just mentioned, for any epidemiologic evaluation, you have to have a trend. So you look for a 5-year period. You cannot take a snapshot. It's like a movie. So you go 5 years. So the 5 years keep moving. So 2020, you're going to be looking at 2016 to 2020.
But there's also year-by-year data in the report between 2008 and 2012.
What media outlet are you
City
with?
Paper?
I'm sorry.
Perry with City Paper.
Okay.
I see this says that 3.9% of the black population is currently living with HIV in DC. That's an increase from the 2011 data, which I think was 3.7%. I'm curious if you guys have a plan to target this number specifically. I know that matches more national trends.
Yeah, I think some of it's probably with increased testing.
It's the prevalence also. What happens is when you're looking for the people living with HIV, you're looking for the prevalence of people living in the district. When the prevalence goes up, that means that even if you have decreased the incidence, that means people are living longer. So you're counting all those cases plus the people that are living. In the past, in the 80s, the prevalence was very small because you have a high incidence and people will die within 2 years. Now, in the district, we have a high in the African-American population, yes, we have the higher incidence, but now they are living longer, and that's why you see that from 3.7 to 3.9 prevalence.
Would the lifespan really make a difference between 2011 and 2012?
Life expectancy before was in the 30s, and now we are talking about 70s. So,
just one thing to add is that also look at the new case data, because you'll see there's been a similar decrease among African Americans in terms of new HIV diagnoses. So we are seeing similar trends in terms of fewer new cases of HIV among African Americans. So a lot of the efforts that we've been talking about, expanding testing, linkage to care, retaining people into care, is showing positive effects. The prevalence data does cover every diagnosis that we've had since 1983. So it does, and again, as Dr. Garcia mentions, as people are living longer, that means those numbers, that prevalence number is going to continue to go up. We also base that against the population of the district. So you have to see that we update that every year as well. So we're doing it about more recent demographic numbers. And so there are some shifts in the demographic population of the city, and that also can account for some of those incremental changes in the prevalence numbers. But the most important take-home news is that we are seeing decreases of new HIV cases among African Americans in the city.
I think, again, just not to be redundant, but to underscore the emphasis that both Mr. Carfin and Dr. Garcia have placed on prevalence, that is a reflection of treatment working, and that is people are living much longer than they used to live. So that the prevalence data will reflect the fact that, again, the treatment is working, and that people, instead of dying at age, 35 or 40, are now living normal lifespans. Sam?
Yeah, Mayor, I'm interested. I know they're making progress on HIV, but some of the other, like chlamydia, that seems to be. What's the word there, and what are you doing?
Yes, we have seen some fluctuations in the numbers of chlamydia and gonorrhea and syphilis, which is actually similar to the rest of the country, is that by year, sometimes the numbers go up and sometimes the numbers go down. Part of that is also around our efforts to diagnose more chlamydia. So that's our efforts around reaching young people, particularly through our school-based STD screening program, and working with our community partners in terms of to make free and confidential testing available to young people. That's where most of our chlamydia is among young people 15 to 24. So the more that we go out and test, the more that we're going to find. But that means then we also are able to treat it and cure it and prevent other long-term consequences to people's health, which could mean infertility and or greater risk of HIV infection. So part of that is due to the efforts around our efforts to be able to find more chlamydia is why we have those numbers increasing.
And one thing, if I may add, chlamydia is, most of the time, is asymptomatic. So that's why you have more cases, because people are being tested more. When you compare to GC, which is extracellular, it's an intracellular. So you have less symptoms. That's why Michael mentioned that there's a higher chance of infertility.
We used to be like, I don't know, the AIDS capital of the country, right? Where do we stand now?
I think we're the ones doing the best right now. I think we're the ones doing the best. If we compare against the other 50 states, I always compare against the states, I think we're doing great. And in terms of the battle that we have not eradicated the epidemic, but if you look at the trend, it's the best trend of any state in the nation.
What about cities, which is what we are?
We are both, actually, Sam. We are a city as designated and undesignated state.
But how do we compare to cities?
And we are improving significantly.
But you don't know where we are on the list.
No, I don't have the numbers in front of me.
Okay.
We're still high based on the fact that, again, we've been effective in diagnosing people and getting people into care, so that means our overall rates of HIV are going to be higher than some cities. We're not the highest, actually. That belongs right now to Fort Lauderdale, but we're sort of in we're in the top 5 of the sort of cities in metropolitan areas with HIV. But again, we're seeing very significant decreases that some other cities are not seeing as sizable in terms of their decreases in new cases. So in that case, as Dr. Garcia mentioned, I think we are advancing in our response to the epidemic.
I think the takeaway for me, Sam, is watching the trend line. And the trend line is going in the right direction, especially when you see the reduction in the number of new cases from well over 100 to 21 in the last data we have that measure new cases in the District of Columbia. 21. It's good progress. Any other questions from the media on this before I take my test? Yes.
Mr. Mayor, Dr. Garcia mentioned that you account for the changes in demographics and population. So, I mean, do we account for people who are like moving into the city who might be infected, and can you just talk about how that gets tracked, and people who move in and move out of the city? You
mean people who may have come here with the disease,
right?
As opposed to having contracted it while living here?
Yeah, and I mean, just that figure of people living with the virus, that includes people who have moved here, not just...
So the number we report only includes persons who have been diagnosed in the district. But we do track those who have moved, and we do have a lot of people. We have over 1,000 people moving into the district every month. So when somebody moves into the district and they have HIV, then we start getting laboratory reports about their health status. So we are tracking in terms of the sort of real population, a real-time population of persons with HIV. And again, we're seeing very good results in terms of persons' health status. We're also participating in a very large study that has been supported by the National Institutes of Health called the DC cohort, and that is also getting real-time data from many of our providers. See Alicia shaking her head, she's a participant in that. And that's being able to give us a real sense of, in real time, how people are doing with HIV, and we're seeing very strong results there. What we're hoping to do, and is probably aim for in our next report, is to actually do a calculation that would give you a number of those persons who are residing in the District of Columbia that are living with HIV. That has been on our to-do list, and that will give you a picture of not just those that are diagnosed, which is what we have to do for the CDC, but also to give you a picture of those who are actually living in the district.
So what's the best way to describe the figure, the 16,072 people who are living with AIDS in the city? Those are people who were diagnosed in the city and continue to live in the city?
Diagnosed and living is the numbers that we report, yes.
And that will include the people that move in, and that goes for everything. Yeah. No, the living with HIV.
If they were diagnosed,
Oh,
if they were diagnosed. I'm sorry, I didn't mean to confuse you. If they were diagnosed in another location, which is also one of the reasons why we lag sometimes in our data, because we have to make sure that when we get a new report of HIV, that they haven't been diagnosed someplace else. So if they were diagnosed in Arizona but now live in the district, they're not in this 16,000 number. But what we are trying to do is to get to that number and be able to report that.
So it's 16,072 plus an unknown number that may have moved in.
Right.
And we don't have any way to quantify what.
Well, we do have a way of tracking that because, again, we get laboratory reports. So once we follow up on those laboratory reports to find out who that person is and if they were diagnosed newly in the district or from someplace else.
Can you say, are there above the 16,000 number that we have? Is it a number in the dozens, in the hundreds, in the thousands?
I would actually say that we're probably approximately around in that number based on when we look at our lab reports and the numbers that we get. Because I'll have to say, not to confuse you further, that 16,000 number could include some persons who have left the district, who are not living here any longer. So we have people that leave and we have people that move in. And so I would say that we're probably around the sort of 15,000 number in terms of persons who are actually living here in the district who are with HIV.
Mayor, before you get distracted with the test, which is an important part of the president, can you first tell us while you're up there in the quiet says your thoughts about Wayne Curry dying?
Well, why don't we do the test and I'll come back.
But then there would be chaos. Everybody would be walking around. I thought you would want to tell. Some people may not even know.
Well, what Tom Sherwood is referring to is that Wayne Curry passed away this morning. He was a good friend of mine, and it's really tough to talk about this. Wayne was just a good friend of mine, and I talked to him during his illness. In fact, interestingly enough, we were trying to set up a lunch to get together. And last time I talked to him on the phone, and Wayne always had a great sense of humor. He said, I swear, I think that the treatment is worse than the illness itself. But he had a great attitude. Some of you will, know that he talked about his illness very publicly. And I think you go back and look at his years as the executive of Prince George's County, and he did an absolutely fantastic job. You know, I used to kid Wayne a lot. I said, Wayne, you were single-handedly responsible for getting the Washington football team out of Washington and into Prince George's County. And, he was proud of that moment and so many other things that he had every right to be proud of in terms of the progress that Prince George's County achieved during his time as the county executive. He was just a good man. And, as you and I were, briefly talking earlier, he had the right attitude about the job. He had a great sense of humor, just a brilliant man. He was a visionary. And so much of the progress that you see in Prince George's County today is a result of Wayne and, what he did for the county. And one of the things he did, too, was I enjoyed working with Wayne. When he was a county exec, I was, I guess part of that time I was the director of the Department of Human Services. And, in the aftermath, we maintained that relationship. When we went out to Las Vegas to the shopping center convention, I always saw him and interacted with him. So there's not enough good things I can say about Wayne Curry. And this county, the county of Prince George's, will miss him. This region will miss him, and his impact will live on forever. While we were talking, I was looking at that poster, if you will, over on that window. And Wayne was, even in his, as he knew that, what he knew was he knew what his fate was going to be, he kept urging people not to smoke and to quit smoking because he knew what it had done to him. And that's who Wayne Curry was, just a great man.
Thank you very much.
All right, let me do my test. And If it starts to feel uncomfortable, I just jam it down my throat?
And then I go in front.
For the dramatic moment, right?
Between the gums and the teeth. Lower. Between the gums and the teeth.
How quickly will the test results be known?
20 minutes.
Are you going to stay for that?
Well, you know, we'll certainly need the story.
All right. For those who were here just for our annual report on our progress around the virus and AIDS, and only here for that, you are welcome to leave. And those who may have other questions or issues, give us 1 minute to let people leave who want to leave, and then we'll go on with that to other issues. Tom?
Mr. Mayor, the city went gaga over the soccer game yesterday. What's the status on your lobbying the council on getting the stadium deal done that Mr. Liu worked on?
Well, we're continuing to work with that. Alan, of course, our city administrator, Alan Liu, is the leader on that initiative. Alan, if you want to come up and join me in answering the question, I'd welcome that. But we're continuing to work with this. As you know, the legislation has been transmitted. We had the hearing last week. There were over 100 people who were signed up for the hearing. There was lots of support there, and there were lots of questions. And we're prepared to answer any questions that may, arise. If we don't have the answers immediately, we will do that. But we think that the city is a place where the interest in soccer is really growing. Certainly not more evident yesterday for those who were on Freedom Plaza. We had an estimated, somewhere around 5,000 people who showed up to watch the USA play Belgium yesterday. And we had only 36 hours actually to plan that. We just thought it would be a great thing for the city, and it turned out to be. There was a lot of enthusiasm. Unfortunately, the USA lost 2-1 to Belgium. But I tell you what, irrespective of the score, our team played an absolutely phenomenal game. And I'm not a soccer aficionado, but I've seen a lot of soccer games, and the goalkeeping by Tim Howard yesterday was absolutely probably the greatest ever of any soccer match. 16 saves, I think that was a record by comparison to 9, over the last 50 years. And of course, while that is great, if I were the coach, I'd be looking at that defense that was supposed to be right in front of that goalkeeper, who keep just like a hockey game. You keep them off the goalie, right? Well, that's where your defense is supposed to work in soccer. You keep them off the goalkeeper. And overall, I think it reflected a lot of progress in our team. Soccer is a tough sport. It's been in some nations for decades. It hasn't been all that popular here for decades, but it will be.
You think it helps the mood from the World Cup helps persuade the council members this is a good deal?
Well, I think so. I think it reflects the interest in soccer here in the District of Columbia. Again, there are a lot of people who support soccer in the city. And there are a lot of people who have come out in one way or the other to demonstrate and verbalize that support. Alan, you want to add anything?
We had the mayor mentioned that we had over 100 witnesses that signed up to testify last Thursday. And we also had, we've been meeting with the council members, so we have an idea of some of their concerns. And some of the issues don't necessarily relate to the soccer stadium, but other matters of government. And we're working through a lot of these things. So we believe we're building support. Many of I think there's over 70 groups that have signed on, to support the initiative. We really think that this is going to be great for the city. It isn't just a soccer stadium. It may be the catalyst that we've incorporated into this to the mayor's proposal, but it is really truly an economic development initiative, which would help generate millions of dollars and create jobs for thousands of people. So we think it's great for the city, great for the future of the city.
just to underscore what our city administrator is saying, the economic development potential and need is great in that area. You look at, it's not immediately adjacent or won't be immediately adjacent to the baseball stadium, but it's in close proximity, maybe a couple of blocks, city blocks away. You look at what's going on the east end of the city, moving away from the baseball stadium, and then you look at that area across South Capitol Street on the west side. It's really blighted. This is going to have a tremendous impact on lifting up that area and bringing lots of economic development opportunity, retail, et cetera, to the west side, of South Capitol Street. Maybe the streetcar. Yeah. Want to talk about streetcars? I'd be happy to talk for the next 3 days about that.
You had the soccer topic. So yesterday you told the crowd that I like soccer more than baseball, football, and basketball, quote, at this point. So we're 18 hours later. Do you still like soccer more than baseball, basketball, and football?
Yeah. Wow. I like sports, Mike. I think you know that. And soccer is, I consider myself also the chief marketing officer for the city. And one of the things this gives me an opportunity to talk about is the increasing athletic activity that we have in the city. I see soccer doing nothing but growing in the city. Our baseball team is doing really well. We won again last night against the Colorado Rockies. And just so everybody knows, I was at the game the other night when they beat the Colorado Rockies. Our basketball team is doing well. We made the playoffs. Went as far in the playoffs as we've done in many, many years this year. And while our football team didn't do very well last year, I think we're going to have a different kind of year. We certainly won't have a 3-13 year this year. So I think what you're seeing is not only a good soccer town, you're seeing a good sports city. And soccer now is a part of the panoply of opportunities that we have available to people. You will have the last question, Lou.
Okay, thanks. Mr. Mayor, possibly related to the soccer proposal or the baseball stadium, I'm hearing reports from some of the customers of one of the few clubs that was able to relocate after being displaced from Washington National Stadium way back when that was built. And it's located near where the new soccer stadium may be built. But what I'm hearing is that DPW, for some reason, maybe Mr. Liu may know this, put large Jersey cement barriers blocking what had been free street parking, or any parking, along part of Half Street Southwest, near where this club moved to, Ziegfeld Secrets it's called. And it is right next to a new parking lot that opened that apparently is being used for stadium goers for the National Stadium. But the collateral impact was that it removed street parking for the nighttime nightclub customers. And I'm wondering just why it was, did the city want to help this private parking lot by closing off public parking on the street?
I don't know about it, Lou. We'll find out. Let me ask Alan if he knows anything about it.
Yeah, I don't have specifics on this, but in that whole area, if you're familiar with the area, the line between where this private property is and where the public property is so murky that people park everywhere, and so I'm not familiar with the Jersey barriers, but we'll look into it. Okay.
We'll ask our communications staff to get back to you, Lou, with an answer on that. Either Pedro or someone he may designate to do that. Mike, you had another question?
It's been a week now since the House committee passed the marijuana amendment to the budget. I understand that the Office of the Attorney General and some lawyers are looking at what the practical effect of that is going to be. has there been anything determined? Do you have any thoughts on what this is going to mean for the city?
No, we're still looking at it in terms of the fiscal impact. First of all, I don't think it should go through. I can't imagine that the Senate would allow this to maintain. You're talking about the rider, is that right? Yeah, I can't imagine that the Senate would allow that rider to be maintained on our budget. And if I can make my broader statement, it once again bespeaks the fact that people are into the business of the District of Columbia who should not be in the business of the District of Columbia. This was a congressman from Maryland who imposed this rider, and go look at Maryland. Hasn't Maryland taken the action that's being opposed here? So. It's hypocrisy at its worst, in my opinion. One, your own state has done this, and secondly, it's just interference in democracy. This city doesn't have to take a backseat to any in terms of how we're operating at this stage. We operate very responsibly every day. We're making progress. We are a growing city, and we ought to be allowed to manage our own affairs in the District of Columbia, period.
Mr. Mayor, just to follow up and to present you with sort of a hypothetical, but if this were to go through, would you urge your successors to take executive action to implement marijuana decriminalization, such as ordering the police department not to enforce criminal laws against marijuana possession?
Well, I'm not going to speculate about this because I hope we can stop it where it is. That's where our efforts will be focused right now, and that is on stopping an action that is irresponsible, and disrespectful, and undemocratic. If you want to know how I really feel, I'll be happy to talk with you more about it afterwards. Thank you all very much.